家好，我是林医师。那我刚好这2个礼拜有了这个机会待在澳洲。那第1个礼拜我参加了一个行为医学的一个研讨会。那今天很荣幸可以在这里专访我们的一个非常厉害的一位讲师，就是 Dr. Kersti Seksel。那我们等下会进行几个问题的专访，那就请各位就是花一点时间，那可以聆听这样子。Okay, so hi everyone, my name is Cindy Lane. I'm a vet from Taiwan, and for the last 2 weeks, I've attended a Behaviour Medicine conference with Dr. Kersti Seksel, and then today we have the honor to invite her for a short interview. So here we go. Do you want to introduce yourself?
Hi, I'm Dr. Kersti Seksel. I'm a registered veterinary specialist in behavioural medicine, and I'm board certified in the US and Europe and Australia and New Zealand.
So the first question, I just want to talk about the message I want to get out there for most general practitioner vets.
Mm-hmm.
In the last week's conference, with the very first thing we brought to the audience was incorporating behavior medicine to general practice. So could you just briefly talk about why it is important for general practitioners to learn or acquire the basic understanding of behavioral medicine, or even better, to be able to address some of the behavior issues to the owners?
Okay. Well, behaviour is what we do every day in general practice. Every animal we see, we're actually assessing its behaviour. The reason they come to the veterinarian is because something has changed. So if they've got vomiting, diarrhoea, if they're scratching, there's a behavioural change which just prompts the visit to the veterinarian. Secondly, it's really important not only to understand their behaviour, but also if we understand their behaviour and their background in pathology, we can actually make the visits to the vet much less stressful for the pet. It's a real welfare consideration for the pet, but it makes life so much easier for veterinarians and their staff if the animal is relaxed, or at least not too stressed when they're trying to examine it.
Talk a lot about normalizing the brain should be done prior to any other sorts of training, because I do come across many owners with dogs or cats, whatever. They have behavioral issues, but they will go through various trainers to try to fix the problem. But often, some of them may come up okay, but a lot of them, they ended up seeing me because, well, the issues at the beginning, it might seem to be doing good, but over time the situation just worsens. Yes, so we talk about the really important 3 M's. I see them as golden rules of treating these issues. That includes environmental management, behavior modification, and medication. Well, to me, I think most people, they have a better understanding in environmental management, although I think a lot of time it is hard to keep a really tight management, but yeah, I wanted to talk about the behavior modification and medication. And so can you talk about how is behavior modification differ from what we know as the obedience training?
Okay. Well, I think the point that you bring out there is that there's a very big difference between a training problem or lack of training, which sometimes dogs appear to have bad manners because somebody hasn't trained them to be polite, and a behavioural issue. And a behavioural issue is a mental health issue.
Right.
So what that basically means, I guess, is that we're dealing with animals that their neurochemistry is not the same as the dog up the road's neurochemistry. And what it means, I guess, is recognising that animals do have anxiety, and anxiety is a medical problem, just like diabetes is a medical problem. And so it's not enough just to teach them to come and sit and stay.
Yeah.
We have to differentiate between the two. We know at least 20% of dogs have an anxiety disorder, so all of them may benefit from learning some good manners, and I think that's important, but it's not the same as behaviour modification. What we're doing with behaviour modification is teaching the animals to relax, to be calm, and also better coping skills when they do go back into the world that they're currently a bit frightened and worried about. So yes, you're quite right, sometimes the training can help because it does give some very clear guidelines for when you want the dog to do things like sit or come, but it doesn't actually help them relax, and that's part of the issue with anxiety issues.
Right. And you mentioned that an anxious animal, it's really a medical problem, so by not treating it, it's actually a welfare problem.
Absolutely.
Yes, so would you talk about how would the animals benefit from getting medication?
Okay. We know that every behaviour is partly genetic, what you've inherited from your mother, your father, your grandfather, etc., partly what you've learnt from previous experiences, and partly also the environment you're in. So that's the 3 M's that we talk about. And if you have a medical issue, then medication is going to help with that. And that's why when you're anxious and worried, and that's the reason most dogs, if we see them for aggression or any other problem, there's an underlying medical cause. What tends to happen is if you are very stressed or anxious or fearful, you can't actually learn, and the medication helps the brain to be more normal so that then the animal can learn better coping strategies.
Right. So it makes sense seeing the medication given to them as you're treating an infectious disease with antibiotics. It's not that much.
It's not different at all, exactly that. And in veterinary medicine, we don't wait, to use your example, until the leg goes gangrenous before we put them on antibiotics. We don't wait until we have ketoacidosis before we treat the dog that's a diabetic with insulin. We step in very, very quickly, and that's the same premise, I guess, with behavioural medicine. If the brain is abnormal, we want to step in very, very quickly to try and normalise it, help those brain neurons fire and wire together in the right way.
Well, I'm afraid many pet owners out there, they have self-educated themselves through either the media or going to conferences or whatever. They have probably learned more knowledge in behavior than most vets in general. So my question is, if these people have concern or they have actually noticed that their pets have behavioral issues, if they want to seek for help, and as a registered veterinary specialist in animal behavior, what is your suggestion to them?
Well, I think going to the vet is always a good thing to do, whether the vet has extensive knowledge about behaviour or not, because they can rule out concurrent other physical issues. So obviously, if there's a dermatological issue that's causing the animal to misbehave, or it's got a sore ear or bad teeth, they can help with that. And then talk to the vet and find out how much they know, and if the vet doesn't know enough or is not able to help because of lack of knowledge, then they should come and see you. It's pretty simple, really. Or another vet that's interested or has knowledge about behaviour. But I do think it's an important part of making sure the animal's welfare is not affected, because these animals, I think they really suffer when they're really anxious and worried, and we can do something about it now, which we couldn't 20, 30, 40 years ago, but now we know we can.
Yeah. Okay, great. And I'm really grateful to be here, and thank you for giving me the opportunity to, share your insights with our fans. Okay.
Well, you're welcome, and Sheshe.
Thank you. 嗨，大家好，现在坐在我身边的这一位是雪梨大学的兽医学系fifth year right 5年级的学生，那他们现在刚好就是在做最后1年的 rotation。那我旁边这一位很漂亮的女生呢，她刚好就是决定来Dr. Kersti Seksel 这边做她的rotation 的一部分。那我们在这边就刚好有时间跟她做一点就是聊一下，让她告诉大家说，为什么她会选择在她其中 rotation 的其中一部分来到这个地方。So, Janet, please tell us about yourself.
Yep, so my name is Janet. I'm originally from South Korea, and I'm a student in Sydney University. So I'm a 5th year in vet faculty, my last year actually. So I'm actually currently doing a rotation with Dr. Kersti Seksel at Behaviour Service. So I think that's a brief introduction of myself.
Great. So tell us about what is your major interest in veterinary medicine, and why did you choose behavioral medicine as part of your rotation?
Well, generally, I really enjoy medicine part, especially neurology, and I also enjoy imaging as well. So neurology and imaging are my, I guess, favorite.
Yeah.
So, parts. The reason why I chose behavior service is mainly because I acknowledge that it's really important. But compared to the importance, I feel like during uni, during the lectures, it wasn't covered very much. And then I thought that this month with Dr. Kersti Seksel, it would be a good opportunity to actually focus and learn about behavior. And that's one of the reasons why I applied for this rotation.
Okay.
Yeah.
So before coming here, what have you tried to gain your knowledge in dog behavior or
Well,
any sort of?
to be honest, I should say that I'm not very knowledgeable in dog behavior and training wise. I don't have a background in that area, but usually my knowledge came from, I guess, based on the lectures that I had, which was very, very limited, and I guess just the internet and yeah.
I know it's only been a few days since you guys started this internship. So what have you learned, or has these experience from the past few days have changed your perspective about animal behavior?
Yeah, so it's only been a week since I've been with Dr. Kersti Seksel, but it actually changed me a lot. To be honest, before I started this rotation and when I was applying for this rotation, I thought behavior, it would be mostly training and I would take up some tips and train dogs or something like that. But what I realized was that behavior was medicine. It was actually based on science, and it was very not very different from other medicines such as like internal medicine or neurology. Like I guess it goes through the same process, like diagnosing it,
Right.
and then having a treatment plan, and then having a follow-up, and then using medication. So that was the big part that kind of made me think differently, that this is a disease that I should treat no different from other disease that I was learned like before. So yeah. So another thing that I wanted to mention is that when I was young, and back in Korea, I used to tell, I wanted to be a vet, and then people used to come to me and talk about dogs. And then this one gentleman came up to me and then asked like, by the way, do animals get cancer as well? And then after that question, I was like, oh my god, this person. And I had that thought, like, it was just impossible to communicate with this person. But when I came to this rotation and realized that animals have mental issues as well, just like us, and then realizing that, it made me realize that I was that person as well, you know? Like, I didn't know that, like, realized in my mind that animals could get mental issues just like us. So it was just like a big moment that, I was no different from that person, how ignorant I was before. So yeah, that's another thing that I learned from this rotation, I guess. Yeah.
Okay.
Yeah.
Okay. Excellent. So what would you suggest or encourage your other vet fellow students to do, or do you have anything you want to say to the future vet students in your school or from my country? Anything?
I would say that stay on top of it. That would be a big advice, because I think behavior has changed a lot since the dominance theory and everything, how that is no longer accepted in the current dog behavior wise. And yeah, just staying on top of it, and then reading the current behavior publications and following through
澳洲昆士兰大学兽医学系第5年的高年级生。那他一样会是跟刚刚那位女孩一样，在这边会有2个礼拜的实习。所以我们等一下会跟他请教一些问题，那请他跟我们分享一些他在这里实习的一些感想。Okay, great. So Jake, tell us about yourself.
Hi, I'm from the University of Queensland, down in Gatton, which is close to Brisbane, and I'm in the 5th year of vet, which is my last year. So currently I'm doing a rotation with Dr. Kersti Seksel at the Sydney Animal Behaviour Service.
Yes. Okay, cool. So what is your major interest in doing veterinary medicine, and why did you choose behavioral service as part of your rotation?
Mainly, I'm into animal behavioral medicine to start with.
Yeah.
That was the main interest, and I'm also fairly keen on behavioral training in general. So I do a fair bit of dog training by myself, and I see how that relates to inability to train and how behavioral medicine can help with that.
Right.
Yeah.
Okay, so you have done some dog training,
Yeah.
and through that you have seen there are some animals you can't really just
Yeah.
go and fix the problem just by training.
Yeah.
So that's where the behavioral medicine stepped in.
Yeah.
Okay. Well, it only has been a few days since you come here, and so can you tell us about what have you learned, or has any of this experience changed your perspective about this specialty?
What I've learned is the issue is bigger than what it seems. Like everyone thinks that it's just a dog, it's just behaving like a dog. But when we have an issue where it's really serious, and it's very evident that it's very stressful for the owners to live with that situation where the dog is either being aggressive or barking too much, and constantly using training doesn't have an effect on it. So I think behavioral medicine is a really good way to help the dog and also help the patient, and also preserve that human-animal bond that might be lost because of an issue that the dog cannot control in general. Yeah.
Okay, because a lot of people, they do love their pets, but sometimes the situation just got really out of control,
Yeah.
and not even the owner knows how to deal
Yeah.
with their own dog, and that's pretty sad. Okay, so what would you suggest or encourage your fellow vet students to do, or to the future vet students in your country or in my country? What would you suggest them to do?
Always have an open mind. Don't believe everything you read on the internet.
That's a good one.
And science is always changing, and opinions are always changing, facts are always changing. So it's good to always keep up to date with the latest scientific information that's available, and don't look at it as like behavioral medicine is a be all and all, that if you do behavioral medicine you cannot train the animal, or the other way around.
Yeah.
Sometimes everything comes together. Things are set out in certain ways, but nothing is certain. So a lot of times you can use the behavioral medicine first, and then that can assist with the behavioral training later. Yeah. So they should work hand in hand, in my opinion. Yeah.
So the biggest message to you guys is keep open mind.
Yeah.